Thank you for inviting me to this important conference. King Faisal Specialist Hospital is a general organization that is a multi-site hospital with 3 campuses, 2 in Riyadh, the city of Riyadh, which is the capital of Saudi Arabia, and 1 in Jeddah, which is the second largest city in the Kingdom of Saudi Arabia. King Faisal Specialist Hospital is regarded as one of the leading hospitals in the Middle East. It has main centers for excellence, which include oncology, solid organ transplant, metabolic and genetic diseases, and cardiology and cardiovascular surgeries. King Faisal has been ranked number 1 in the Arab world by Webometrics, and it has very advanced state-of-the-art technology and clinical services. It's considered a quaternary, tertiary quaternary hospital that provides the most sophisticated treatment for our patients in the region, and it's the main referral hospital in the Kingdom of Saudi Arabia. We also receive referrals from neighboring countries, including GCC countries. King Faisal Specialist Hospital has very important aspects in terms of operation and functions. It has also more than 1,500 beds distributed between Riyadh and Jeddah, soon to be about 2,500 beds with the introduction of the pediatric hospital, King Abdullah Cancer Center, and the expansion of Jeddah site. Any hospital must have a formulary system, and this is a recommendation by the World Health Organization as well as the Joint Commission International. The functions of the formulary management committees is to develop a list of formulary medications through evidence-based, independent and neutral reviews of submitted medications for addition, and also to govern the use of medications and utilization within the healthcare system itself. It's a fundamental step in any hospital to have, since the budget of medications is continuously increasing year after year, and medication cost is becoming one of the highest factors or part of any hospital budget. There are multiple factors. I can summarize them in cost effectiveness. So rationale, cost effectiveness is one of the most important factors. So another important factor is safety. So we have 3 actually different cornerstones in selecting any medication. Safety profile of the medication, efficacy of the medication, and cost effectiveness. All of these 3 must be at very high level in order to select any medication. And in order to evaluate medications for these 3 different items, we need to conduct an independent, comprehensive, evidence-based review and select the best available for our hospital or our region, depending on whether you work in a hospital or in a large healthcare system such as Saha or Ministry of Health or others. Definitely yes. Any committee that would like to develop a formulary, best standard formulary, must have several challenges. One is, this is an extra work, it's a lot of work, needs a lot of large and extensive clinical experience, a lot of resources in terms of medication reviews, independent medication reviews, a lot of meetings, a lot of reading, collective wisdom and collective decision made by a huge or large group of healthcare professionals, including physicians, pharmacists, nurses, supply chain, quality personnel. And one of the challenges as well is that most of the work is voluntary work. People do not get paid to do this, but it's for the good of the institution that you work for. I shared our experience in building state-of-the-art formulary management system that is totally automated, electronic, and paperless. By developing a web-based electronic system for running formulary management committees that addresses all the challenges that I just mentioned, including security, confidentiality, no need for papers, tracking, archiving, and report generation. And I showed them the system that we developed internally with the help of our information technology personnel, and we designed it ourselves, we patented it, and we are actually publishing our experience in international medical journal. Actually, almost in the world, we are not aware of any hospital in the world, including the United States, that have adopted an electronic, fully electronic system to run formulary management, including blind voting, automatically generated reports, using different platforms and OSs, operating systems. And currently we run our committee without any paper, using iPads. We have developed an iPad designed application for our formulary management system. I believe that such conferences are very important to share experiences with neighboring countries within the GCC and exchange ideas, exchange thoughts, and share the experience, which is very important to know what others are doing, how well you are doing compared to others, learning from each other. I think this is a wonderful opportunity for all of us to learn from each other and also to share our experience. And I think also it provides a young generation a very important venue to get exposed to advanced practices and systems in different healthcare systems. I would like to thank the organizing committee for inviting me to be a speaker. I have a workshop tomorrow about generic substitution, and I will be addressing how to evaluate generic substitution in hospital settings. And I would like to thank you guys for a wonderful organization, and I would like to ask you for more to come.